have our class on neurology, and basic behind the neurology study is that we are going to understand the concept behind our nervous system in details, check on various pathological that can result to any interference with our normal perception and transmission of impulses in our brain and our spinal cord and the peripheral nervous system, inclusive of the autonomic disorders. So that is what you are gazing up to right now. And from your hand, if you're using the YouTube to learn on this one and to listen to what we're learning today, kindly do not forget to subscribe. So our outline under neurology, we are expected to have clinical examination of the nervous system, functional anatomy and physiology of the nervous system, investigation of neurological diseases, how their presenting problems are, the headache syndromes, vestibular disorders, epilepsy, disorders of sleep, cerebrovascular disorder, inflammatory disorder, neurodegenerative disease, infections of the nervous system, intracranial mass lesions, and the raised intracranial pressure, the ICP, disorders of the spine and spinal cord, disease of peripheral nervous and the neuromuscular junction, disease of the muscles at large. So we are going to view and understand all the concept of what that I've just stated. So let's start with the introduction. So the neurological diagnosis primarily relies on history and examination. Just like any other condition or medical condition, you really need first to interview the patient by general history taking, and then after that you will use your meticulous history to have an impression, control a diagnostic aperture, and even send for investigation or specific investigation. So after after the neurological history taking and examination, you need now to have an investigation support or roll out a diagnosis. The investigation will now tell you if at all we've confirmed the cerebrospinal fluid does not contain bacteria. Therefore, our diagnosis is not narrowed to bacteria. We are now checking on virus. So the various or the broad array of the investigations always give us the hint on how to rule in and out of the common problem that we have laid an impression after taking an history. Then we have neurological symptoms and signs often result from systemic disorder. So how are we going to evaluate neurological symptoms? We do get neurological symptoms during general physical examination and systemic examination. By that, you're able to see if at all there are some reflexes which are not jerky, like you can do the patella, kneecap reflexes. You can also check on the probability of the cranial nerves, how they respond. Do the entire 12 cranial nerve examination, then you'll realize if there is systemic disorder in a way. So the example of investigation that are supposed to be sent in the lab, the basic tests are like the hematological test that composed of all the tests surrounding the blood, be it the hemoglobin, be it the white blood cells, the mean capsular volume, right? There are very many hematological examination, even culture and sensitivity is still under there. Then you have renal test. We have renal functional test, right, which we are going to check on the blood urea nitrogen concentration. We shall check on the creatinine level in the blood, right, and even the glucose. Then hepatic, that is just the liver functional test. Then you can have urinalysis as well, right? Urinalysis and renal test, they always portray the same. So you'll get to gauge what are the components of urinalysis and how you're supposed to take them. Attributary urinalysis is done to confirm whether there is anything to do with the glucose, ketones in the urine, blood in the urine, bacteria in the urine, and so on. And then you can have basic imaging or radiographic imagings like the chest X-ray. That is what is represented by CXR. We can have another one that is CT scan. We can have X-ray on every other part. We can have ultrasound if necessary. So specialized tests, those are basic. Now on the specialized test, we'll have the LP. LP means lumbar puncture. You can have a lumbar puncture or just a spinal tap. You tap for the cerebrospinal fluid, and then you use it, you culture for sensitivity to detect if there is any bacteria. For example, meningitis in young babies is always ruled in or out by lumbar puncture. Many other conditions, seizures, can also be done. Mainly the investigation is lumbar punctures. Neurophysiology, that is now assuming to note the specific function of the neurons, and the neuroradiology, having picture of the neurons and seeing how they work. Then you have neurogenetics, which is mostly done using the karyotype. So I hope my screen is still very lively. Now let us proceed, and whatever we are going to have next here: investigation, usually indication, the syncope, the seizure, stroke. Right, so we're gonna have investigation and what we are targeting. Like investigation and what it can help you to know. Like if you have hemoglobin, the HBs, you will detect whether we have syncope. You know, hemoglobin has a direct relation to how oxygen is applied to your body, because that is a carrier of the oxygen molecules or other atoms. So when the hemoglobins are low, definitely they can attribute indication of syncope. Syncope is that short absence of consciousness due to inadequate oxygen supply to the brain. As well, hemoglobin can also help us rule in or out the seizures, or maybe stroke. That is stroke. We can have the cerebral stroke, especially when you have the severe cerebrovascular accident. So seizures comes in, syncopes comes in. Then you have mean capsular volume. Normally helps you to indicate whether there is problem to do with the B12 deficiency, which can result to anemia. So with the parameters of the mean capsular volume, you know that you need to know the normal. And today with the digital world, you can find some lab report has already listed for you the normal ranges. White blood cells count, they give us infection like meningitis. Mostly white the white blood cells will always shoot when you have viral infection. They'll increase in size. Yeah, we'll have something called leukocytosis. The leukocytosis simply means there will be an increase in what we call the white blood cell count. Normally at 11,000 millimoles per decil of blood. 11,000 is always a hallmark, but that is for white blood cell count, but it can shoot more than that. Right? Then we have the peripheral blood film. This one will help us to know acanthocytosis. Acanthocytosis is just the toneness, the structure of red blood cells, how they look like. Acanth is a Greek word which means stone. So the shaggy, the neuroacanthocytosis, how the blood cells in the brain looks like. So with the peripheral blood film, can diagnose and see how the structure looks like. That is acanthocytosis. Then you have sedimentation rate. This one tells us most of inflammatory reactions. You see how the blood components settle when you leave in the blood sample in the test tube for sometimes. See how the faster they settle, tells you about the giant cells which are responsible for inflammation. Similarly to the C-reactive protein, which is produced in large scales during inflammation, depicts the same. Then you have the B12 and folic acid will also give us information or indicative information about presence or absence of anemia in patients. So you can check on the peripheral neuropathy, dementia. Dementia is a condition characterized by loss of memory. Yeah, so with the folic acid, we can deduce on that possibility of peripheral neuropathy or dementias. Red cell thermine causing what we call the Wernicke-Korsakoff syndrome. The Wernicke-Korsakoff syndrome is characterized by huge memory loss, right? Weakness, fatigue, discomfort, changes in behavior. So that is always a result of the thermine absence in there. So there's a reduction in the red cell thermine. Then you have clotting thrombophilia screening, which will now give us if there is any inherited condition resulting to absence of some factor like protein S, protein C, the thrombotic factors like the antithrombin proteins, and so on and so forth. They also give us an indication of stroke if there is the absence of those clotting factors. Therefore, blood can clot on the brain, resulting to blockage of the various blood vessels in the brain, causing a stroke and necrosis and even the ischemic death of the brain cells. So blood culture also can give us direct diagnosis of things to do with the bacterial infection like meningitis, endocarditis, and stroke as well, because some bacteria can result to blockage due to their toxins. Still on that, we have angiotensin converting enzyme can result to give us an indication of sarcoidosis, antinuclear factor under the rest of diagnosis, DNA that will give us indicative of stroke. rheumatoid factor and antiphospholipid antibody, peripheral neuropathies. Yeah, and we have them very many. The other one give us myasthenia gravis, the STR antibodies, anti-human, anti-yo antibodies will give us encephalitis diagnosis. Anti-calcium channel antibodies will give us Lambert-Eaton myasthenic syndrome, and serum immunoglobulin will give us myeloma. So you can enlighten and check over on those factors for you to be well sobered with the knowledge. Let's now go to cerebrospinal fluid analysis. Why do we need this one? It will always indicate, if possible, meningitis number one. Any symptoms or maybe history which gives you a nearby impression on meningitis, you can follow it with an investigation by starting with the LP, lumbar puncture, collect the cerebrospinal fluid, take it to the laboratory for analysis. So meningitis can be that. Encephalitis, if you suspect encephalitis, you can also call for that. This one is multiple sclerosis, can also be responsible. Yes, MS is multiple sclerosis, can also be done on by investigating on the CSF. Then malignant infiltration, especially the one which affects the bone marrow, if there is any cancer tumor which is metastatic. So we have some ranges, right, in the CSF. Normal ranges, opening pressure will be 50 to 200 millimeters of water. Cell count above 5 lymphocytes. Protein 0.2, 0.5. Glucose to 1/3 of the blood glucose. Then acute, if it is infested with acute bacteria, you'll get the pressure increased. That is now above 200 of water. We'll have more neutrophils, that is 100 to 6,000 neutrophils. And then we'll have a range of protein 0.5 to 5. Then there will be decreased blood glucose. Tuberculosis, increased pressure, 10 to 500 then lymphocytes. Then the same remains as that one of acute bacteria. Yeah, then there's decrease. Then fungal increase, that is 25 to 500 lymphocytes, they remain constant. Viral as well. No or raised, can be not raised or raised, but that is for pressure, but it can have lymphocytosis. So you need to come and check over again, still on the autoimmune polyneuropathy. You get on polyneuropathy, autoimmune polyneuropathy. We have normal, increase, normal. So you're gonna have that. Then SAH, which is subarachnoid hemorrhage, normal, increase. That is increase and normal. So check on that. Cell count will be increased, pressure will be normal or increase, and then glucose will be normal. Multiple sclerosis, normal or increase, lymphocyte normal. Then we have septomeningeal syndrome, normal or increase. So I'm gonna check on those, and you need to know the parameters, and you always need to read so that you can keep on remembering for exams case. Urine test kits. When now we go to urine test kits, what you need to have in your mind is that you have to check on the urine glucose level, urine glucose level can even help you to diagnose diabetes, urine ketones levels as well. So in neurology, diabetes, it can result to some nervous conditions, nervous system condition. Ketones as well. Urine Benz-Jones proteins. These are always given proteins found in the urine, and they depict inflammatory changes in the urinal structure, like the nephron and the glomerulus. Urine porphobilinogen, a typical protein also, which is so. Summary: investigation do not cover up for an adequate history and examination. So to me, don't just go to investigation. You have to first have an history and the examination properly. Pragmatism in choice of investigation. That means that you should prioritize investigation based on the model or the attributable factor. How important is this related to others? If you have a list of investigation that you need to inquire, start from the most, or debug, do some research on which one is the best before. Then we have practice doing lumbar puncture so that you don't make mistake. Remember, there's some effect or after effect that always follows if you don't know how to position the patient correctly. What are the contraindications of lumbar punctures, right? And after the lumbar puncture, how long do you require the patient to rest, and what are the exact sites where you should perform to the lumbar puncture? The contraindications are key thing. So practice doing the lumbar punctures. Presenting problems: headache and facial pain, that is after the lumbar puncture. Dizziness and blackouts, at most weakness, acute confusion state, memory loss. Headache and facial pain, I'm sure you directly can figure out what is that. Dizziness and blackouts, you are drowsy, you feel like sleeping. Blackouts, you can go into a state of unconsciousness, you're weak, acute confusion state to mean you don't understand or realize anything. There is memory loss. So it's very severe. Then we can have memory loss, you even forget your environment. Visual disturbance to mean that you can adhere to some shimmering lights which can distort your image for up to 20 minutes before it restores off. Then you have sphincter disturbance, speech and language disturbance as well. Sphincter disturbance relate to incontinence in the region where there is sphincter. For example, the sphincter in the bladder, if there is disturbance, it will result to leakage of urine. You can also have incontinence or bedwetting as well. So that is that. So we're going to start on epilepsy on the next, but as for now, that calls for the end of our today's lesson. Thank you and have a nice time. Do not forget to subscribe on our site.